Hello, Melvyn. How are you
Hi.
doing?
Very good.
Melvyn, I have some question to ask you. We are going through a difficult time with quite a lot of uncertainties. What is our group take on the current situation in Myanmar?
So the COVID-19 situation is a serious one, and we cannot be complacent. But I feel that we are prepared, and we cannot be panicking at this time. For me, the most important thing is the health and safety of our people. So you will see that we've implemented a lot of policies to ensure that we are kept safe. At the same time, we are going to have to support our partners, support our customers, and support our people. This COVID-19 situation is not going to go away anytime soon. We have to expect a prolonged period of business disruption. How we come out of it will define our own leadership position.
What has the group done to prepare?
We're lucky to have gone through a number of these situations, like SARS in 2003. And we recognize COVID-19 can be a very serious matter as early as January. So many of you would remember that in January, we asked everyone to have a thermal scan when they come into the office. We also even restricted travel at that early stage. Over the last 2 months, we've been looking at the news on a daily basis, and we've implemented a lot more travel restrictions. In addition to that, we've added additional policies. All of you who are traveling would have to declare yourself. We're also putting in place our business contingency plans. You know, it's very easy for this market to be disrupted, and we need to make sure we know exactly what to do when other situations and different scenarios play out.
Thank you, Melvyn. Where should staff get information on COVID-19 related information?
We have a new app. It's called Yoma Connect. And for those who have not downloaded it, please download it. This is the app that is not just for COVID-19, but for the future as well. It has useful information like policies and leaves. But at the current moment, all the most important information will first go out on Yoma Connect. For those who do not have the app, it's also on the internet, so you can search for it directly.
Thank you, Melvyn. Some of us are not sure what we should do if we are sick. So what should they do?
Now, for those who have a fever, who are coughing, who has respiratory symptoms, or has breathing difficulties, and whether that's for you or family members who live with you, please don't come to work. In fact, please isolate yourself, rest, and seek medical advice if you need to. Now, for those of you who are not sure, we've also added an email. It's called askdoc@yoma.com.mm. So that is a useful place for you to ask any medical information, and a professional will come back to you with advice.
One more important question, Melvyn. What is our current domestic and international travel policy?
I strongly advise everyone to limit your travel. Whether it's domestic or international, let's try to avoid that in the near term. Now, our official policy is that for certain locations that are high-risk locations, it is prohibited to travel to those places. You're also asked to declare yourself whenever you travel, and that will extend to domestic travel. I recognize that with Tinjan coming up, many of you will be having holiday plans. We need to track where everyone is so that if there's any outbreak in any location, we can figure out how we can avoid contamination.
Thank you, Melvyn. My last question for you. What's your final message to the group?
So with all crises, it is important for us to have the right perspective. And we will come out stronger as a leader if we can do this well. In this particular crisis, we have to be prepared for a prolonged disruption. But there are some simple things that would really help us get through this. And I advise all of you to really advocate that to your friends and family. Good hygiene is the best way to protect ourselves. So that includes washing your hands regularly. That includes social distancing, so not sitting too close to each other, not sharing utensils. Avoid large-scale gatherings as much as possible. These simple steps would help all of us and can really stop this virus from extending.
Thank you very much, Melvyn.
Thank you.